Hi, everyone. My name is Sharita Martinez, and I'm going to be sharing in this video my interview reflection for our class. I had the opportunity to do an interview with a psychiatrist at Nellis Air Force Base Hospital here in Las Vegas, where we live. We have access to the Air Force Base because my husband just retired from the Air Force, and we stayed here in Las Vegas after his retirement. But I had the opportunity to do a interview with one of the psychiatrists at the hospital on base. Her name is Dr. Shonda Smith. She is a military psychiatrist at Nellis Air Force Base Hospital. She specializes in mental health care for active duty service members, and she helps them manage their psychological challenges and also balance the demands of military life, family life, and just everyday life. Her job duties as a psychiatrist, she shared with me that some of her primary responsibilities are assessing, diagnosing, and treating service members that have mental health conditions. She prescribes medications, she provides therapy, and collaborates with other medical team members in the hospital to ensure that the patients receive the ultimate care that they need, even if they have to collaborate with other clinics. She evaluates whether individuals are fit for duty, also, which is a crucial part of her role in that military setting. What she found most fulfilling was that she shared the most rewarding part of her job was really seeing her patients improve, whether that was being able to just function better at work, strengthen their relationships, or simply just feel more at peace in their day-to-day lives. Knowing that played a really big role, that she played a really big role in their progress, really seemed like it made her work more meaningful. Some of the challenges that she shared with me in the specifically in the military industry as a psychiatrist was having to deem a service member unfit for duty. She understands how much military members value their careers, how they come to love the mission that they're called to do, and ultimately their ability to deploy. When she has to make that difficult decision, it's sometimes emotionally challenging because she knows how much it's actually going to impact their future, how it's going to impact their career at times. As far as professional growth, Dr. Smith says that she stays up to date in her field by attending military coordinated conferences every year, typically. If she is unable to attend those ones that are coordinated for them already, she finds other professional development opportunities on her own, whether locally or online. And the military really supports continuing education by reimbursing travel costs for any conferences that have been approved. And these events help her stay informed on the latest psychiatry research and best practices. Now, some of the advice that she gave for students pursuing in this career field was to focus on areas of psychology that they are genuinely interested in order to prevent burnout. She emphasized the importance of self-care, which is something she personally prioritizes by spending time with her family, was one of the things she shared, going on vacations, hiking, and also enjoying spa days. There's a lot of spas here in Las Vegas. Taking breaks and setting boundaries help her maintain balance in this demanding career. So this interview really brought back a lot of memories for me personally for my time in the service as a mental health technician, which is a different role than what I will be going into. Working with the military mental health professional was professionals was a really meaningful time and experience for me. And hearing Dr. Smith's perspective, it reminded me why I was drawn to this field in the first place. It was very inspiring to hear her, how she helps service members, how she helps them navigate through challenges, helps them in their relationships with their families, and just also how she balances her own well being. One of the biggest takeaways for me was her advice on focusing on what you enjoy in this area. Psychology is a broad field, and burnout is real, especially in mental health, military mental health. Choosing a specialty that aligns with your personal strengths, things that genuinely excite you, things that you're interested in, is so important. And this conversation reinforced my desire to return to helping military members and their families and really give back after the time that we served. This interview also really reinforced the importance of self-care and having a work-life balance in this profession. So that's something that I'm definitely going to keep in mind throughout my time, even while in school. um, Dr. Smith seemed to be really dedicated to her patients, and she really emphasized that importance, the importance of self-care. Overall, this was really exciting and eye-opening experience, and I'm grateful that I had the opportunity to reflect on my work in mental health in the past, and also gain some new insights from her perspective and what it's like now, because it's been several years for me being in this career field. So I'm really looking forward to being able to give back to military communities and their families. It's something that's always near and dear to my heart, because I know the the important work that they do as military members, but also the toll that it can take on individuals and on their families. So I'm looking forward to really giving back in this specific area. But thank you so much for watching my interview. Thank you for the interview to Dr. Shonda and Dr. Shonda Smith, and I hope that you can gain something from this as well, and really get to see the different interviews that are being done, and some of the takeaways, and some of the opportunities that you all got to experience doing these interviews as well. So thank you again for watching, and I hope you have a good night.